Hey guys, how are you? So I hope this is streaming. Let me check for that while I talk to you guys. So welcome to MCQ Marathon Part 3. That is going to be the last part for gross anatomy and neuroanatomy of the head and neck as an MCQ session, right? So I'll wait a bit and let me set up everything to then. I hope you're live. You can all see me. Just say hello if you can hear me, right? Welcome to Let's Crack NEET PG, the YouTube channel of Unacademy NEET PG division, and where we'll all help you to crack the NEET PG exam. Plus, my goal is also to help you guys in your MBBS right now if you are preparing for your first profs, right? And if you're watching this video at a later date, this is an MCQ session, right? So you can skip through all the questions where you feel that I'm giving pauses to get some answers from the people who are interacting live with me here, like Smile with Bindu. So today I have some bonus questions for you. So today what we are having is question number 101 to 150. And then I have some bonus questions from whatever topics I feel have not been discussed adequately, right? So for complete coverage, we're going to be doing around 75 questions today, right? And these are some extra previous year questions. Okay. So here you'll have the top educators, the quality content that you need, and a great learning experience. So coming to who I am, my name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, AIMS, New Delhi, India's top medical college. And my rank in the AIMS examination, All India rank was 4, All India rank in JIPMER was 5, right? And today we are going to have the MCQ Marathon Part 3. So we're already done with Part 1 and Part 2, where we had 50-50 questions each from miscellaneous bunch of questions. Okay, and I have discussed various topics before that. So the main two videos that I want you all to watch is Cranial Nerves Part 1 and Cranial Nerves Part 2, right? And the other video that I want to watch is Blood Vessels of Head and Neck. Okay, and I've also discussed the blood supply of the brain. So these two are very compiled lectures which are very different from the material you will find anywhere else. Okay, these are very good lectures that you should watch to get a general orientation of everything that is there in head and neck. Okay, so next let me talk to you about Unacademy Plus because I have to do that. So if you're watching this on a later date, you can probably skip this. So you can see this screenshot here. You have a strategy course on dermatology, you have courses on genetics, then you have a foundation course which is a batch course where everything is covered together, right? And so you can see that here is another batch course for the central nervous system, which is an integrated batch course, right? And then you have a strategy course on general medicine. So all of these courses are available on Unacademy Plus, right? Where you have some great educators, and this is a logged course. So you basically need an Unacademy subscription for this. But you should still download the Unacademy Learning app even if you don't plan on taking the subscription. Now, why is that? Because there are special classes on the Unacademy platform and these are free of cost, right? These are free of cost. That is, you don't need a subscription here. And you can see that now all of these classes, they're not logged. So you have these for anatomy, surgery, whatever you want to study. And you have free test series also where you have free mock tests. You have weekly mock tests, right? Which are part of the Unacademy Plus thing. And then the good thing here is that since we're all medicos, we all have a busy schedule. So we have to learn according to our own flexibility, right? Both in terms of time and in terms of place. So you can, the best thing about Unacademy is that you can learn anytime and anywhere. You can learn in whatever language you want, ठीक है, इंग्लिश में भी, एंड मैं हिंदी भी उतनी अच्छी ही बोलता हूँ, तो अगर कुछ हिंदी में पूछना हो तो हिंदी में पूछ सकते हो, हिंदी में टेक्स्ट कर सकते हो, कोई इशू नहीं है मेरे को. अनलिमिटेड प्रैक्टिस कर सकते हो, लाइक वी आर डूइंग एन एमसीक्यू मैराथन राइट नाउ, and you can chat with the educator, you can have interactive polls and you can basically do anything. ठीक है, तो ये इंस्टॉल करना है ऐप यहाँ से आपने प्ले स्टोर पर जाके, ठीक है, बड़ा अजीब सा इन्होंने टैब बनाया है बट कोई बात नहीं. तो नीट पीजी सब्सक्रिप्शन के बारे में आई हैव टू टेल यू, वंस यू डाउनलोड द ऐप यू कैन टेक द सब्सक्रिप्शन इफ यू वांट. So you have all of these plans: 1 month, 3 months, 6 months, 12 months, 2 year. ठीक है, आगे I'll talk to you more about the plans. Right now, what I want to tell you is about entering a referral code. So obviously अगर डिस्काउंट मिलेगा तो डिस्काउंट लोगे ना, तो डिस्काउंट क्या लेना है? You have to use a referral code or a coupon code that is my name Chaitanya and 10 after it, right? And then you have to click on apply. ठीक है, ज्यादा छोटा कोड एंटर करना है तो SPCM एंटर कर देना. ठीक है, अप्लाई कर पे क्लिक करना, यहाँ क्रेडिट्स लग जाएंगे. ऑलराइट, एंड विद दीज क्रेडिट्स यू कैन गेट अनदर 10% ऑफ. तो 10% यहाँ से मिला, 10% यहाँ से मिला, 20% ऑफ ये हुआ. प्लस आई विल पास, इफ यू कॉन्टैक्ट मी आई विल पास ऑन सम ऑफ माई पर्क्स टू यू. ठीक है, तो ये मिलेगा आपको अगर आप अनअकैडमी प्लस सब्सक्रिप्शन लेते हो विद माई रेफरल कोड एज अ न्यू यूजर. ऑलराइट, then you apply it, you use your credits, this is your proceed to payment. You can pay either as a one time payment or you can use EMI. All right, so this is your entire thing that you have to do. Okay, so now let me talk to you a little bit about what are the various plans. Okay, so you have the 1 month, 3 month, 6 months, 12 month, 18 months, 24 months, and 3 year. These are all the various plans that are there for Unacademy Plus. Okay, smile with Bindu. Classes have not started yet in my college, but I am back in college. As you can see, I am in my hostel room. So, but we're still not started with our classes, right? We were supposed to get them started by 5th October, but let's see what happens now. And then you have the Unacademy Plus से भी ऊपर की एक चीज, that is Unacademy Plus plus Prep Ladder. Okay, तो इसका नाम है सब्सक्रिप्शन का आइकॉनिक सब्सक्रिप्शन. Okay, and this is the one I'm going to recommend to you. This is 1 year, 1.5 years, 2 years, and 3 years. So I think if you are in the second year, you should take this plan directly. Abhi ke abhi le lo, because these prices are going to increase soon. Why? Because they see this three. First of all, this is a 3 year plan, so this will cost you 2,300 per month. Okay, and you are getting a 10% off with my referral code, that is Chetanya10. And like I already told you, I will tell you how to use credits. I will tell you how I can pass on my perks to you, and you will, this will cost you somewhere around 70,000 actually, if you are able to use the credits and my perks. तो ये 70,000 के आसपास का पड़ेगा. And if you see 70,000 divided by 36, that is less than 2,000 per month. Okay, which is around the amount of money that you spend on your outings every month. ठीक है, आजकल तो नहीं, but otherwise. So you should definitely take the iconic subscription. You can take it for a shorter period if you just want to give it a trial, or you can take just the Unacademy Plus if you don't want Prep Ladder. But Prep Ladder is pretty useful because there you have to have you have a few teachers like GRG and Ortho there, which are pretty useful. And in fact, I am planning to watch GRG myself. So this is the iconic subscription where you get the best of both worlds: Unacademy Plus, which is already India's largest online learning platform, and Prep Ladder, which is a very established uh, app for medical preparation, which has been recently acquired by Unacademy. Yeah. So let's start with the first question for today. Glossopharyngeal nerve, it gives which of these? Glossopharyngeal nerve, it gives A, the tympanic nerve, B, the pharyngeal plexus, C, tonsillar branches, D, all of the above. Okay, so let's start with the first question. Let's see who is able to answer the fastest for this question. Question number 101. Glossopharyngeal nerve gives which of the following branches? Okay, guys. So waiting for an answer from your end for this question. A, tympanic nerve. Bindu, that answer is wrong. Why? Because So you know that, okay, you said A, but I'll tell you that this answer is wrong. Have you heard of the nerve supply to the tonsils? Yeah. So basically, the tonsil also receives its nerve supply from the glossopharyngeal nerve. You're right in saying that the tympanic nerve comes from the glossopharyngeal nerve, but then you should also know that it takes part in the pharyngeal plexus, and it also takes part in giving a tonsillar branch. So it has all three branches, the glossopharyngeal nerve. The correct answer is going to be D, that is all of the above. All are branches of the glossopharyngeal. Question number 102. All of the following structures are in the lateral wall of the cavernous sinus except, right? So these are four options. You have to tell me which of these structures is not in the lateral wall of the cavernous sinus. Yes, you're right. Tympanic plexus is formed by the glossopharyngeal nerve that is present over the promontory on the medial wall. है ना? You're correct with that. Alright. But there are other things as well that you have to consider, and those are also given by the glossopharyngeal. Question number 102. All of the structures are in the lateral wall of the cavernous sinus except. So which of these structures is not in the lateral wall of the cavernous sinus? Mandibular. Alright. So let's see. So the mnemonic here that I have been stressing on is O Tom Cat. Right? So the structures in the lateral wall are these, and the structures inside are these. Okay. So oculomotor is there, trochlear is there, ophthalmic division of trigeminal is there, maxillary division of trigeminal is there, but mandibular division of trigeminal, it won't be there. It is present a little lateral and a little inferior to the cavernous sinus. So Bindu's answer is correct. Okay, so answer is going to be C for question number 102. Question number 103. All of the following structures are related to the cavernous sinus except. Again, a very simple question for you. Which of the following structures is related? Okay, so this is kind of a multi-answer correct since this is a PGI type question. By related, it should mean that they are present either in the lateral walls or they are a content. Okay, that is when you are going to say related here. Okay, it should either be present in the lateral wall or it should be a content. A and D. Yes, absolutely correct. The optic nerve is not in any way related here, and as we saw in the previous question, the mandibular division of trigeminal, it is also not related to the cavernous sinus. So the answer is going to be both A and D. Both A and D. That's correct. Right. So let's move forward. Question number 104. Trigeminal nerve does not supply. So the trigeminal nerve, it has a motor supply, right? As you must be aware, it is a mixed nerve. Since it is a mixed nerve, it has sensory component, it has motor component. So what does the trigeminal nerve not supply? Which of these does the trigeminal nerve? I'm looking for the fastest answer here. If there are multiple people watching, please put in whatever your answer is. Even if you are not sure, feel free to take a guess. Feel free to try and maybe think of what the answer could be. Okay, so Smile Window is saying C, anterior belly of digastric. Okay, are there any other answers? Does anybody else want to take a try here? And I'll tell you that this answer is wrong, Smile with Bindu. Because see, what is special about the digastric muscle is that it has two bellies, right? There's an anterior belly of the digastric. There is a kind of a pulley here, and then there is a posterior belly of digastric which runs together with the stylohyoid. So stylohyoid, posterior belly of digastric, and anterior belly of digastric. The anterior belly of digastric, along with the mylohyoid, they are innervated by the mandibular division of trigeminal, whereas the posterior belly of digastric and the facial nerve and the stylohyoid, they are innervated by the facial nerve coming out of the stylomastoid foramen, right? So anterior belly of digastric is definitely innervated by trigeminal. Lateral pterygoid is a muscle of mastication. Masseter is a muscle of mastication. But buccinator, it is a facial muscle. So it is innervated by the buccal branch of the facial nerve, right? So answer is going to be option B. Is going to be option B. Since here we are talking about the motor supply. We are talking about the motor supply. Question number 105. What is the Alderman's nerve? Alderman's nerve, right? So we've talked about this. What is the Alderman's nerve? Also known as the, what is another name for the Alderman's nerve? That is Arnold's nerve, right? And you also know its significance since we discussed it in the previous class. So you're seeing C, it is the auricular branch of the vagus. That's absolutely correct. It is an auricular branch of the vagus nerve. The Alderman's nerve, also known as the Arnold's nerve. So, like, there is an auricular branch or a tympanic branch of the glossopharyngeal known as the Jacobson's nerve. Here you have the Alderman's or the Arnold's nerve. So, see, remember, 7th, 9th, and 10th. This has a branch in the ear known as the cauda tympani. 9th has a branch known as the Jacobson's nerve. And for the 10th, you have a branch known as the Arnold's or the Alderman's nerve. And this nerve, its clinical significance is with the ear cough reflex. The ear cough, you have cough receptors in the ear. It is stimulated inside the ear, you will have the cough reflex being produced. Question number 106. Cranial accessory nerve supplies. What is the nerve supply of the cranial? What is the nerve supply of which muscle is through the cranial root of accessory? Remember, through the cranial root of accessory, not the spinal root, the cranial root of accessory. So I hope you remember that the cranial root of accessory, it does not supply anything by itself. It supplies whatever structures it has to by the help of vagoaccessory complex or the pharyngeal plexus. Question number 106. What is going to be your answer? T, soft palate. Yes, that's right. So the cranial root of accessory nerve, it will supply the soft palate. It will supply the soft palate, and that is the correct answer, right? Welcome, Papa Ethos. So yeah, so the sternocleidomastoid and trapezius, they are supplied by the spinal root of accessory. Now, what about the splenius capitis? It is supplied by the dorsal ramus of C3, C4, as far as I remember. Okay, but you can just check it once, but I'm most probably very sure. So let's move to question number 107. We've discussed this question multiple times. The palsy of the right genioglossus. So, okay, wait, I'll write it here also. Splenius capitis, it is supplied by the dorsal ramus of T3 C4. Okay, remember the dorsal ramus, not the dorsal root, because the dorsal root is always sensory. The dorsal ramus. Question 107. Palsy of the right genioglossus causes. Alright, so I hope you know the right genioglossus. It means that it is a muscle of the tongue. Be a fairly easy answer. A. Deviation of the tongue to the right. Papa's Itu is saying that's the answer. So perhaps Itu is saying Upsitu. I don't know how to pronounce that name. Puja 2 is saying deviation of the tongue to the left. See, after multiple discussion, we have discussed this question so many times. I'll explain it again, no worries. If this is your tongue, the action of your genioglossus muscle of the left side is to push it towards the right side, right? And the action of the muscle of the right side is to push it towards the left side and forward. So it is a protruder and it applies pressure on the opposite side. If the right genioglossus is damaged, the left genioglossus will push it towards the right side. So there is a deviation of the tongue to the right, and there is an atrophy of the tongue on the right side. So there is atrophy and there is deviation to the ipsilateral side. Atrophy and deviation to ipsilateral side. Whereas if you see in the lesions of soft palate, etc., the deviation is generally towards the opposite side. Okay. Question number 108. Puja 2 has changed her answer. Question number 108. So you have to tell me which is true regarding the trochlear nerve. True regarding the trochlear nerve. So again, this is a multiple answer correct. Multiple answers correct. You have to choose more than one options here. More than one options. Once I have a single, once I get an answer, I will modify this question a little and then it will become easier for you. Smile with Hindu is saying A, B, C. He's saying A, B, C. It arises from the dorsal aspect of the brain. Absolutely true. It is the only cranial nerve that arises from the dorsal aspect of the brain. So this has to be true. Okay. Papa Situ and Anatomy 3D Atlas, you're still missing one option. That's okay. Option B is smallest cranial nerve but longest intracranial course. That's true. It is the thinnest cranial nerve. So they've used the word smallest, and which is the thickest? It's trigeminal. But it has the longest intracranial course. Alright, this is another high yield fact that I taught in the first class on cranial nerves itself. This is the first slide of my lecture on the cranial nerves. Option C, its damage causes an ipsilateral superior oblique muscle palsy. That's true because it supplies the superior oblique SO4LR6. Its nucleus, it is located in the caudal mesencephalon. Yes, it is located in the midbrain at the level of the inferior colliculus. So if this is your midbrain, you have two levels here. One is the level of the superior colliculus and one is the level of the inferior colliculus. This will be the rostral, that is towards the head, the rostral mesencephalon, and this will be the caudal mesencephalon. This is true below the cerebral actor. Yes, also true. And this is the false statement. It descends between the posterior cerebral artery and the superior cerebellar artery. Alright, so it descends between these two arteries. So Shabnam Khan has included D in the answer. So Shabnam is right. The answer is A, B, C, D. I don't know why Shabnam did not include C, because C is a very clear-cut answer on the nerve supply of the trochlear nerve. Like it supplies the superior oblique muscle. So this question, if I want to frame it as a single answer correct, I will frame it as false regarding the trochlear nerve, and then the answer will be E. And then the answer will be E in that case. Alright. Now let's move to question number 109. Which of these is a depressor of the mandible? Alright. And I hope you can understand this by the orientation of the various fibers. Question number 109. Which is a depressor of the mandible? Papa Situ is saying temporalis. Okay. So remember temporalis, its fibers. Okay, I'll show you how the temporalis looks. Kind of looks like this shell or a CP as you call it in Hindi, right? That the one that you find on beaches, you know, that is how I like to imagine it. Then there are some vertical fibers running like this. There are a few oblique fibers running like this, and then there are a few horizontal fibers running like this. So now tell me, if these fibers are running like this, what will their action be? Their action is to pull the mandible upwards. Their action is to pull the mandible upwards. So it is a elevator of the mandible, not a depressor. Okay, it is an elevator of the mandible. The only depressor of the mandible is the lateral pterygoid. Remember this, there is an exception here. The medial pterygoid, the masseter, and the temporalis, all of these. So remember, all muscles of mastication are elevators of the mandible except the lateral pterygoid, which is the only opener of the mandible, only opener of the mouth. Okay, now can you tell me why this would have happened? Like, why is there only just one muscle to open the mouth and why there are three to close it? Because of gravity. Okay, even if I don't use the lateral pterygoid, my mouth will automatically open with the help of gravity, right? But to close it, I will need anti-gravity muscles. Yeah, so that is why you have more muscles, more powerful muscles for closure of the mouth and for elevation of the mandible rather than for the depression of the mandible. And that muscle is the lateral pterygoid. If you look at the orientations of its fibers, they're going downwards like this, and pull the they can depress the mandible by bringing the head of the mandible forward. Now, question number 110. The nerve of the pterygoid canal is. So which of these is representing the nerve of the pterygoid canal? It is also known as the Vidian nerve of the pterygoid canal. So which of these will form the nerves of the pterygoid canal? So you have this option: sympathetic plus LPN, sympathetic plus GPN, chorda tympani, and Jacobson. So I hope you know what is chorda tympani, what is Jacobson's nerve, what is Arnold's nerve, what is Alderman's nerve. Okay, Arnold's and Alderman's are the same. Okay. Question number 110. The answers that I'm getting. Smile with Bindu has said A. Shabnam Khan has said E. But the first correct answer is from Fard Narsiha. From Fard Narsiha. The correct answer is B. It is formed from the greater petrosal nerve. Alright, I don't know why the written is official, but it's greater petrosal nerve plus deep petrosal nerve. These two nerves they combine to form the nerve of the pterygoid canal. That is the correct answer given by Narsiha and Papasitu. Alright, this is the nerve of the pterygoid canal. Shabnam has also changed their answer, so answer is going to be B. Alright, not A, not C, not D. Chorda tympani is a branch of the facial nerve. Jacobson's nerve is a branch of the glossopharyngeal nerve. Greater superficial petrosal nerve, this is a branch that comes from the geniculate ganglion. It does not relay there, right? But it is the parasympathetic and it runs in the nervus intermedius. Alright, it runs with these fibers run with the nervus intermedius. Then it moves out from there and leaves the facial nerve, and then it joins with the deep petrosal nerve coming from the internal carotid artery plexus, and then they will form the nerve of the pterygoid canal. Question number 111, right? Tympanic plexus is formed by which of these nerves will form the tympanic plexus? Question number 111. Yes, so it is a multiple answer correct. First of all, I forgot to tell you all. So all of you have included one correct answer here. Smile with Bindu and Shabnam Khan and Papa Sithu. That one of the options is A, that is the tympanic branch of the glossopharyngeal nerve. Alright. So one of the nerves forming this is the tympanic branch of the glossopharyngeal nerve. And then there is the involvement of another nerve. This is the involvement of another nerve. Right. And what that nerve is going to be, that is what you have to tell me. There are two options correct here. One you have already told me that is correct. And you have to tell me one more. So let's talk a little bit about the, चलो इसमें A ठीक है अब आगे चलो एक मिनट एक पीछे डाउट आया था व्हाट इज द फॉर्मेशन ऑफ द pharyngeal plexus what is the formation of the pharyngeal plexus so pharyngeal plexus it has three components one it has the pharyngeal branch of the vagus right which carries fibers of the cranial part of accessory carries fibers of cranial part of accessory right the first thing this means cranial nerve number 10 plus cranial nerve number 11 second is that it has a pharyngeal part of the glossopharyngeal nerve, right? Pharyngeal branch of glossopharyngeal nerve. And third thing it has is the pharyngeal branch from superior cervical sympathetic ganglion. So it has some sympathetic fibers coming from the superior cervical sympathetic ganglion. So you can first take a screenshot of this and you come to know about the pharyngeal plexus. You come to know about the pharyngeal plexus and then we'll talk about the tympanic plexus. Then we'll talk about the tympanic plexus. Okay, let me know when I can remove this from here once you've taken a screenshot because this is an important concept to summarize everything that you learn. Yeah, right. That is about the tympanic or pharyngeal plexus. Now the tympanic plexus, it is formed by the tympanic branch of the glossopharyngeal nerve and there should have been another option here that is the sympathetic branches from the carotid plexus. Okay. So these are the two things that will form. So you were right. The only answer from the options here was A, and the other option should have been the sympathetic branches from the carotid plexus. Okay, but since this is not there, this will be the only answer. But my point why I told you about the pharyngeal plexus is because I wanted to tell you that both in the tympanic and the pharyngeal plexuses, you have the involvement of glossopharyngeal nerve in both cases, and in both cases you have the involvement of sympathetic branches from the carotid plexus. What is extra in the pharyngeal plexus is that it also has its vagoaccessory complex, which is the main part of the pharyngeal plexus. That is the nerves coming from the vagoaccessory complex, that is from the vagus and the cranial part of the accessory. Okay, that is about the pharyngeal and the tympanic plexus. I hope ये concept clear बन रहा है mind में because we haven't discussed this in our previous videos. And my point of all these classes was to make sure that your head and neck is covered at least at this level कि profs में pass हो जाओ और जो भी MCQ आए वो कर लो है ना Question number 112. Features of trigeminal nerve injury include. So what all is included in trigeminal nerve injury? Trigeminal nerve injury. So there are two very important cranial nerves, that is your trigeminal and your facial nerve. Okay. So these two nerves you should know in detail, all the reflexes related to them, all the supply related to them, all their branches. Any answers for question 112? It is also a multi-answer correct, guys. Multi-answer correct. So, Pat Narisha is saying that one of the answers is paralysis of temporalis and masseter muscle. That is absolutely true. These are muscles of mastication, so they will be supplied by the motor division of the mandibular division of the trigeminal. So, motor root of mandibular division of trigeminal will supply the muscles of mastication, so there will be paralysis of temporalis and masseter muscle. Okay, if this is true, then C also has to be true. Weakness in mastication. C and E are true, right? So C, D, E has been written. Then you have written loss of, because, and also because these muscles of mastication. I just told you that except the lateral pterygoid, the remaining three are very important for the closure of the jaw, for the elevation of the jaw, because that has to be done against the gravity. So B will also be true, you know. And then you have written loss of corneal reflex. Absolutely, because the ophthalmic division of trigeminal, the corneal reflex, the afferent is through the ophthalmic division of trigeminal, and the efferent is via the facial nerve. So this is again a true statement. Okay. Then sensory loss of face is what you are missing. Sensory loss of face will also be there because you know about this nerve supply. That this upper part is through V1, then this part is through V2, and then you have some part with mandibular division of trigeminal. So because of this cutaneous distribution, you will also have sensory loss of face. So all of this is a question that you can write in your subjective answer as features of trigeminal nerve injury. Question number 112. Next question, question number 13 for today, 113 for our oval or MCQ marathon. Secretomotor fibers to the parotid gland, they pass through. What do the secretomotor fibers of the parotid gland pass through? Geniculate ganglion is what you think here. Correct answer is otic ganglion, like Smile with Bindu has said, not the geniculate ganglion. See, first of all, remember that the secretomotor fibers to the parotid gland, they are going to be parasympathetic fibers, right? So they are parasympathetic fibers. They have to go through a parasympathetic ganglion, and the only parasympathetic ganglions in your body are four, right? Ciliary ganglion, otic ganglion, phenopalatine, phenopalatine, erigopalatine ganglion, and submandibular ganglion. So only these four ganglions can give parasympathetic fibers, none other, right? So the geniculate ganglion, it is not a parasympathetic ganglion. There is no lesser ganglion which is parasympathetic, and there is no sphenopalatine ganglion which is parasympathetic. The only answer is option A, that is the otic ganglion. The only answer is option A, that otic ganglion. You could have done this by elimination. It will not be B, it will be option A, otic ganglion. Now, otic ganglion is topographically related to the mandibular division of the trigeminal, and it is functionally related to the glossopharyngeal, and the nerve fibers are coming from the inferior salivatory nucleus, which will give a supply to the parotid. Okay, so that is how you can do this question by elimination as well. Now let's move to question number 114. Safety muscle of the tongue is. So which of the following is the safety muscle of the tongue? If you guys want the PDF of this session, you guys can subscribe to my Telegram channel, that is at the rate NEET PG Chetanya, right? So this is the Telegram channel that you should subscribe to. So right now we're doing anatomy. Tomorrow we are going to be doing neurophysiology at 3 p.m. and we'll have probably 100 MCQ session tomorrow as well. So to cover the basics of your neurophysiology. So yes, safety muscle of the tongue is genioglossus. Question number 114. The answer is going to be B. Why it is genioglossus? Because genioglossus is responsible for protrusion of the tongue. Alright. So it takes the tongue out and forwards, right? So since it moves the tongue outside, it prevents the tongue from falling back and obstructing your nasopharyngeal passage. So right, not the nasopharyngeal passage, the passage for your air and passage for your food, that is your pharyngeal passage, right? So if it falls backward, it would be obstructing that, and that is why genioglossus is the safety muscle of the tongue. All right. Question number 115. The superior cerebral veins they drain into. So in which vein do the superior cerebral veins drain into? Okay, so what would you do has given an answer for question number 115, and so has smile with Bindu. Yes, so the superior cerebral veins they will drain into the superior sagittal sinus, right? Superior sagittal sinus. This is the correct answer. This is the superior sagittal sinus running here, and here you will have the superior cerebral veins, and they will all drain here into the superior sagittal sinus. Question number 116. Facial nerve supplies all except. Alright, facial nerve supplies all except. So there is one gland here that the facial nerve does not supply, and which of the following is those? A lot of you answered D, so that's the correct answer, parotid gland. Why? Because the parotid gland is innervated by the otic ganglion via the glossopharyngeal nerve through the inferior salivatory. Explanation for this. Question number 117. Subcutaneous muscle extending from the clavicle to the mandible. Subcutaneous muscle extending from the clavicle to the mandible. Clavicle to the mandible, subcutaneous muscle. Think about it. Very easy answer. Very, very easy answer. Yes, the answer is going to be platysma as correctly pointed out by Shabnam and Papasitu. It is platysma. Platysma is a subcutaneous muscle. The moment you hear subcutaneous muscle, the first thing that should come to your mind is platysma. And since it is in the region of the neck, the clavicle to the mandible, it has to be the platysma. It is the subcutaneous muscle here. It is present in the superficial fascia, right? Question number 118. Muscles of the tongue are supplied by. So which of the following nerve supplies the muscles of the tongue? Question number 118. The answer that you're saying is D. Muscles of the tongue are supplied by the hypoglossal nerve. Muscles of the tongue are supplied by the hypoglossal nerve, all except the palatoglossus. Right? Absolutely true, Shravdeep. Absolutely true. Question number 119. The cranial part of the accessory nerve, it supplies all the palatal muscles except. So the cranial part of the accessory nerve, it supplies all palatal muscles except. All palatal muscles except. C. Tensor villi palatini. Absolutely true. Question number 119. The answer is going to be C. Why? Because remember both the tensors, they are supplied by the trunk of the mandibular division of the trigeminal, its motor root, right? So tensor tympani and tensor villi palatini both are supplied by the mandibular division of trigeminal. Palatoglossus, which is a muscle of the tongue also, it is supplied by the cranial part of the accessory, palatopharyngeus and levator villi palatini. All of these are supplied by cranio accessory, that is the vago accessory complex. Question number 120. The nasolacrimal duct, NLD, is directed in which manner, question number 120, in which manner is the nasolacrimal duct directed? Okay, Smile with Bindu has given an answer. Papa Situ has given an answer. So this question is slightly difficult. So obviously it will be directed downward because here is this is your nose, right? It has to open here below the inferior meatus below the inferior concha in the inferior meatus. So first of all, it obviously has to be directed downward, right? Then since it is going on the lateral wall, it is going on the lateral wall of the nasal cavity from the medial side. So it is going like this. So it has to go downward and laterally. So option A you can eliminate and option D you can eliminate because both of these say medially. Now does it go forward or backward? That you have to know it has to go backward. So it is present in front here and it goes backward till here, right? Just to go backward. Alright. So the answer is going to be option B, 120th B. I am glad so many of you are able to answer. It goes into the inferior nasal meatus of the nasal cavity, yes, partially covered by a mucosal fold, which is known as the valve of Hessner. It is known as the valve of Hessner, right? Something like that. Not sure of the spellings, but yeah, it's an incomplete mucosal fold which forms a partial valve there, right? Question number 120. Question number 121. Structures which are seen in the pons but are not seen in the medulla at the olivary level section, at the olivary complex level section. Okay. So medulla you can take three sections, remember, and one of the levels of that section is the olivary level section. Structures which are seen in the pons but they won't be seen in the medulla at this level. Right. So you are saying middle cerebral punctum. First, let me tell you this is a multi-answer correct. First, let me tell you that this is a multi-answer correct. So you are right in your one answer that one of the answers is middle cerebral peduncle, but there is also one very obvious answer that should be there, that should be included in your answers. While with Bindu and Shramdi, there is one answer that is very obvious and should definitely be included in whatever answer you are giving. Yes, Smile with Bindu has correctly got it. It's the motor nucleus of the trigeminal. Motor nucleus of trigeminal is present in the level of the pons from where you have the trigeminal nerve coming out as the motor and the sensory root, and this is the fourth nucleus of the trigeminal. The ICP is present here because it comes inferiorly. It is also a part of the floor of the fourth ventricle, yes. So, and the nucleus ambiguous obviously extends downwards. Okay, so B, C, D they are seen in the medulla as well as the pons, but A and E they are part of Basically the B, C, D, they will also be seen in the medulla at the level of the olivary section. But A and E, they are not seen in the medulla, but they are seen in the pons. Right? Question 122. Which of the following is the true statement about parotid gland? Again, a multi-answer correct. Let me tell you, multi-answer correct. So let's see, you can identify all the correct options. Okay, I'm not saying who can identify the correct option. I'm saying who can identify all the correct options. Right? ED. All right. Absolutely true, Smile with Bindu. You have identified all the correct options. See, it is the second largest salivary gland. This is false. It is the largest salivary gland. Okay. So it won't be E. What about B? Stensel's duct is the duct of the parotid gland. It opens behind the crown of the second upper molar, right? So it opens against the crown of the upper second molar, not the third molar. So this is also false. A and B are false. What about E? Only benign? No. You can have parotid malignancies, and that is why you have to do parotidectomies, because you can often have parotid malignancies, and it is also related to a lot of lymph nodes. Okay. So that is about 122. Let's move to question number 123 regarding the surgical anatomy of the thyroid gland. Regarding the surgical anatomy of the thyroid gland. Again, it is my duty to tell you that this is a multi-answer correct. Multi-answer correct. So the best thing about multi-answer correct is that it helps you know everything. You cannot directly exclude answers. So multi-answer correct makes sure that you are well aware of everything surrounding a particular concept, and that is why you have to be as detailed, as thorough in your approach as possible. All right. Okay, Shramdeep is a NEET 2021 aspirant. Or glad you're able to attempt all these questions in that case. Question number 123, guys. Can you at least select one answer? Since multiple are correct, try to at least point out one answer. Third semester. Right. So 123, the answer first is that the buried ligament. So it is an extension of the deep cervical fascia. It is a deep cervical fascia which goes and attaches backward, right? So it is an extension of the deep cervical fascia, the berry ligament. So if this is your thyroid gland, this is your deep cervical fascia. There's an extension coming here that is known as the suspensory ligament of berry, or simply the berry ligament. This is A, right? Thyroid is enclosed between two layers of deep cervical fascia. No, this is false. The deep cervical fascia encloses the sternocleidomastoid. Here you will have the pretracheal fascia. All right. So see longer course of the recurrent laryngeal nerve on the left than on the right. This is true. Why? Because on the left it has to curve around the ligamentum ductuosus. and on the right it has to curve around the subclavian artery. This is true, right? Subclavian artery. A, C are true. Then what about D? Yes. The superior thyroid artery is related closely to the external laryngeal nerve. The inferior thyroid artery is closely related to the recurrent laryngeal nerve. Alright, so this is one thing that you have to remember. A, C, D ho gaya. Then E is incorrect. Superior thyroid glands are located ventral to the recurrent. No, they are located dorsal. Alright. So that's about 123. Yes. A, C, D. So a lot of you were able to identify. So as a group, you have identified all the correct answers. Smile with Bindu said C, Papa Situ said D, and Mishti has also said A. Question number 124. Skin over the angle of the mandible and parotid area supplied by. We have discussed this question many times. That the skin over the angle of the mandible and the parotid area will be supplied by. It's this extra region of skin which is visible in this region. So this additional skin, it will be supplied by which nerve? Not the auriculotemporal nerve. This is a branch of the mandibular division of the trigeminal. Facial nerve will give you a motor supply. It does not have a sensory supply here, right? Posterior auricular nerve, it will go behind and supply this region. It cannot be supplying the angle of the mandible here. The only option left is the greater auricular nerve, C2, C3. And it is very important to know that there is some part of the face that is not innervated by these divisions of the trigeminal, and there is this anterior-inferior angles of the masseter that are innervated by the greater auricular nerve. So the answer is going to be option A. Alright, question number 120. Question number 125. Pseudo-unipolar neurons are seen in. Where do you find pseudo-unipolar neurons? Yeah, C2, C3. Mystery is right. C2. Okay. Celiac ganglion. Nope. Very straightforward answer you have here. While you complicating the answers, olfactory ganglion. Nope. A very straightforward answer, something that you've been studying since your class 11th also. Pseudo-unipolar neurons. They have a central process, they have a peripheral process. Yes, so the answer is going to be C, spinal dorsal root ganglion. The answer is going to be C, spinal dorsal root ganglion. Question number 126. Which of the cranial nerve decussates within the brain? Question number 126. Which of the cranial nerve decussates within the brain? Yes, 125 with C. Very simple, straightforward answer. Don't think too much. Niharika is here. She's right. Question number 126. Very special nerve. It has a lot of weird features, right? You're saying 126, some are saying A, some are saying B. First of all, the optic nerve, it does not decussate within the brain, it decussates outside the brain, right? So you can see it decussates at the optic chiasma, and it is not present inside the brain, right? It is not within the brain, it is within the cranial cavity. It's not optic nerve. The cranial nerve that decussates within the brain is the trochlear nerve, right? So if you see the level of the inferior colliculus, if I draw a section at the level of the inferior colliculus, and this is the cerebral aqueduct, a little inferior to it, you will have the trochlear nucleus. The trochlear nerve arises and it decussates here within the brain, and then it exits from the dorsal aspect of the brain and moves ventrally like this. So the trochlear nerve is the one that decussates within the brain, not the optic nerve. The optic nerve decussates within the cranial cavity, but it does not decussate within the brain. The answer is going to be option A, that is the trochlear nerve. And only Mishti has given the right answer. Niharika, Shabnam, and you are okay. So I hope this is clear. Yes. Trochlear nerve decussates as it moves dorsally. Before exiting, it has already decussated, and the crossed part it moves outward. It goes dorsally and then it moves ventrally like this. Yeah, that is the course of the trochlear nerve. Then you know it passes between the posterior cerebral and the superior cerebellar artery. Then it will move forward, go through the lateral wall of the cavernous sinus, move further forward. That is why it has the longest intracranial course. Also, since it has a very long intracranial course, it is uh, not because, but otherwise it is the thinnest cranial nerve since it has to innervate only one muscle, that is the superior oblique muscle, SO4, right? That is about this. Question number 127, the sensory nerve supply of the pinna. So what is the sensory nerve supply of the ear pinna? Sensory nerve supply of the pinna. Okay, so a lot of you are saying auriculotemporal. So it's not A here. The answer is correctly as pointed out by Bindu and Shabnam, which is C. It is facial nerve. ठीक है? तो पहले मिष्टी का गलत था, बिंदु शबनम का गलत. तो पहले मिष्टू का सही, मिष्टू कह रहा हूँ, मिष्टी का सही था, बिंदु और शबनम का गलत था. अब उल्टा हो गया. ठीक है, ओके, कोई बात नहीं. Right. So the answer is going to be the facial nerve. Why? Because there is a branch known as the auricular branch of the vagus. Remember, there is an auricular branch of the vagus, and this auricular branch of the vagus, it moves with the facial nerve. So it is carried topographically by the facial nerve, and it is the main nerve supply of the inner. The answer is going to be C. So it is not. We're not talking about the motor innervation here. We are talking about the sensory nerve supply of the pinna. And you should also know that the sensory nerve supply of the tympanic membrane, sensory nerve supply of the tympanic membrane comes from, this comes from the glossopharyngeal nerve. It comes from the glossopharyngeal nerve, that is the tympanic branch of the glossopharyngeal nerve, which will then move forward and form the tympanic plexus. Tympanic plexus will give rise to what is known as the lesser petrosal nerve, right? That is all you need to know about here. Question number 128. Trigeminal nerve has how many nuclei in CNS? One of my favorite questions. How many nuclei does a trigeminal nerve have in the CNS? Right? Answer very carefully. Please don't be in a hurry to answer this. Okay? Please don't be in a hurry to answer this. Let me write down here. Bindu is saying A. More answers. Give me more answers. Niharika is also saying A. Okay. Niharika is now saying C. Ramdeep is saying B. Shabnam is saying B. Perhaps it is saying. चलो बहुत सारे आंसर्स मिल गए. Answer is option B. I discussed this exact same question in my lecture on cranial nerves. And this is for clarity, first of all, that the answer is going to be B because there are four nuclei in the cranial nerve. There's no doubt about it. I hope you know about the mesencephalic nucleus of the trigeminal. Okay, number one. Let's draw these nuclei for so that this picture is clear in your head that there are four nuclei. There are not three, there are four nuclei. And Niharika, what is the fifth nuclei? I have no idea. Right? I have only heard about four. This is the mesencephalic nucleus of the trigeminal extending into the midbrain. Then you have the chief sensory or the pontine nucleus of the trigeminal, and then you have the spinal nucleus of the trigeminal extending up till the C2. Remember, the spinal cord is also part of the CNS, although some part of this is also present in the medulla. ठीक है, तो ये नहीं सोचना कि स्पाइनल न्यूक्लियस को हटा दें हम. स्पाइनल कॉर्ड भी तो सीएनएस का पार्ट ही है. ब्रेन प्लस स्पाइनल कॉर्ड होता है सीएनएस. ऑलराइट, तो सेंसरी. हाँ, तो चार ही तो हुए. चीफ सेंसरी, मोटर, स्पाइनल एंड मीजेंसेफेलिक. राइट, ये कौन सा हो गया? मीजेंसेफेलिक. ये हो गया चीफ सेंसरी या पोंटाइन. ये हो गया spinal nucleus of trigeminal. Plus you will also have the motor nucleus of trigeminal. Please don't forget that trigeminal is a mixed nerve, so it also has a motor supply, so it will also have to have a motor. It will have a motor nucleus. ठीक है, तो clear हुआ ये question? It's a very common scope for a silly mistake here. Please be careful. ठीक है, तीन न्यूक्लियस कौन से बने? एक ये बना, एक ये बना, एक ये बना, एंड ये कौन सा बना? मोटर न्यूक्लियस ऑफ. आंसर इज गोइंग टू बी 4. 129. What are the branches of the ophthalmic artery? What are the branches of the ophthalmic artery from these? Alright. You have to choose the branches of the ophthalmic artery from these. So I have you were given around 5 here. So you have to choose which all are the branches of the ophthalmic artery, which is a branch of the internal carotid artery. The ophthalmic artery, remember, it arises from the internal carotid artery as soon as it leaves the cavernous sinus. So it is a branch that is coming from the part that is distal to the cavernous sinus, and it is a branch of the internal carotid artery. Ophthalmic artery is an important artery. Yes, so you're right. The central retinal artery does arise from the ophthalmic artery. A is correct. B is correct. Central retinal artery, it moves inside the optic nerve. Okay, it is an end artery. A is correct. All right. B is also correct. The posterior ciliary artery also comes from the ophthalmic artery. Right. Now we have to see the other options. Now we have to see the other options. It's a little confusing, right? So what happens here is that I'll tell you that first of all D will not be included. Will have answer will be A, B, E. Why? Because the anterior ciliary artery, it does not arise from the ophthalmic artery. It arises from the muscular branches that supply the rectus. So the arteries that supply the lateral rectus, the arteries that supply the medial rectus, and superior rectus, the inferior rectus. These arteries, these are muscular branches, and they together they will give the anterior ciliary artery, not the ophthalmic artery. The anterior ciliary arteries, they're almost seven small arteries that are present in the eyeball, and they're derived from the muscular branches of the ophthalmic artery. So they're not per se branches of the ophthalmic artery. They're coming indirectly as branches of the branches that go to the muscular recti. Okay. So what are the branches of the ophthalmic artery? Let's go through all the branches once. Okay, just to give you an idea that you should be able to, if you have to recall all the branches. First is the lacrimal artery. So we'll change the pen color. Branches of ophthalmic artery. And remember, ophthalmic artery first by itself is a branch of the internal carotid artery after it exits the cavernous sinus. The first thing that will come is the lacrimal artery. First branch that it gives is the lacrimal artery. Then it also gives other branches that are known as the supraorbital artery here when it exits outside, right? Then you have to know that during its course it has to give the anterior and posterior ethmoidal arteries, right? Then it gives a few palpebral branches, supraorbital, and it also gives the supratrochlear. We forgot the supratrochlear, and during this time it also gives the dorsal nasal branch, which anastomoses with the angular artery, and it is an anastomosis between the external and the internal carotid, right? So then you have the dorsal nasal artery. Then you have to give the palpebral arteries. You have to give a few palpebral arteries. Then you have long and short posterior ciliary arteries. Okay. Then you have two branches here. One is the central artery of the retina, and then after that, two branches that I was talking about was the eighth and the ninth. That is the superior muscular branch and the inferior muscular branch. The superior and the inferior muscular branches together they will give the artery to the anterior ciliary artery. So you can consider the anterior ciliary artery as a branch of the ophthalmic artery, but the reason why I'm not considering it is that it comes from these arteries rather than coming directly from the ophthalmic. Okay, so that is about this. And the accompanying veins, as you know, are the superior ophthalmic vein and the inferior ophthalmic vein, out of which superior ophthalmic vein is an emissary vein. Yeah, so that is about this discussion. So yeah, E is also correct. So I have already said that A, B, and E are definitely correct. D has to can or cannot be considered correct, but it is more important that you know the concept because now, as you know, that MCI has already been dissolved. Questions that will be asked will be from the next pattern, right? So all of those questions will be clinical. You will not need to worry about whether to count this, whether to not count this. So you can simply know the concept rather than knowing the answers. All right. Question number 130. Lacrimal gland is supplied by which of the following ganglia? Lacrimal gland is supplied by which of the following ganglia? Okay, so you are saying otic ganglion, Shabnam? No, otic ganglions will supply the parotid gland via the glossopharynx, not the otic ganglion, won't be the otic ganglion. So Bindu is saying ciliary ganglion. Oops. Ciliary ganglion is going to supply your parasympathetic. It is also a parasympathetic ganglion, but what does it supply? It has your does not go and supply the lacrimal. It supplies your muscles, right? Your sphincter pupillae and your ciliaris. So it does not supply the lacrimal gland. That is important to know that even though it is present in the orbit, even though this is present in the orbit, it is supplying the sphincter pupillae, giving post-ganglionic parasympathetic fibers to sphincter pupillae and to the ciliaris muscle, rather than giving fibers to the lacrimal gland. The lacrimal gland gets its innervation from the sphenopalatine ganglion. So remember, you have maxillary, then it gives the zygomatico-temporal branch, then gives a communicating branch to the lacrimal nerve, right? And that is how the lacrimal gland is supplied. So the ganglion related to the maxillary nerve is the pterygopalatine or the sphenopalatine ganglion, one and the same thing. And these four are all the parasympathetic ganglions of your body. So the answer is going to be option C, sphenopalatine ganglion, as correctly pointed out by Niharika and Mishti. Okay. Ciliary ganglion, you might think that it is present in the orbit, so the answer is going to be ciliary ganglion, but no, the ciliary ganglion supplies the muscles like the sphincter pupillae and the ciliaris, rather than supplying the lacrimal gland. Okay, question number 131. Guys, don't retract your messages. Okay. Again, nobody is judging you here. Nobody knows your real names. And even if you make a mistake, that's okay. Right? So we're all in a learning phase. And I feel that it's okay to make a few mistakes because you can't be expected to know everything in one go, right? Make a mistake, you learn, then you're expected to be okay. Following ligaments are present in the temporomandibular joint. So if you can't see the word, it's temporomandibular joint, TMJ, except. So few of these ligaments are not present in the TMJ. Remember that TMJ has an articular disc, fibrocartilaginous articular disc that you have to remember. Yes. Papa Situ is saying C, but that's wrong. It's not the stylomandibular ligament. It is the alar ligament, right? The answer is going to be D, alar ligament. Can Mishti and Niharika tell me that where do you have the alar ligament exactly? Where exactly will the alar ligament be located? Tell me the location of the alar ligament. Even if you don't know it exactly, give me an approximate idea and then I'll know that you know about the alar ligament. Also know there is something known as the alar fascia, something known as the alar. No, no, B and C, no, no. The answer is only D. B and C are ligaments related to the temporomandibular joint, right? So I hope you know what does alar mean. What does alar mean? Alar means resembling a wing. Remember we used to study estivation of a petal and we used to study keel, carina, right? Of the peak. So alar means that it resembles a wing, and the alar ligament is found related to the occipital condyle. So it is present in your joint between the base of your skull and your atlas. That's the whole place where this is present. The joint between the base of the skull, the atlas, and the axis. That region, that is where your alar ligament is. Okay. Yeah, related to your odontoid. Okay. Question number 132. Roof of the olfactory region is formed by. So which region, which bone will form the roof of the olfactory region? Of the olfactory region. Right, Shramdeep. And that's why you can imagine how it will be resembling the wings, how it will be resembling wings. That is how you remember the names of all these things. Remember that there's some sort of a butterfly here or a bird here that is connecting the occipital dens with the base of the skull, that is the occipital condyles. And that is how you remember that, okay, that ligament is like a butterfly or like wings, and that is called as the alar ligament. Okay? 132 is simple. The answer is going to be the cribriform plate about of the ethmoid. Why? Because the cribriform plate is pierced by the olfactory nerves. So the roots of the olfactory nerves. So it has to obviously have a lot of holes to allow all that to pass from the olfactory mucosa upwards into the anterior cranial fossa, and there is a crista galli in between. Also, I told you yesterday about lamina cribrosa, which is present in the eyeball, which is a modification of the sclera, allowing the fibers of the optic nerve to pass through. The fibers of the olfactory nerve, they pass through the cribriform plate of the ethmoid, and the fibers of the optic nerve, they pass through the lamina cribrosa of the sclera. They pass through the lamina cribrosa of the sclera. Okay, that's about question number 133. Ipsilateral deviation of the tongue is due to paralysis of. Ipsilateral deviation of the tongue is due to a paralysis of. Okay, guys, first of all, please note that all of these that are written, so Bindu, Shabnam, and Niharika, all of you that are saying C, please note that Niharika, Bindu, Shabnam, and all of you have said C. This is the hyoglossus, first of all. This is not the hypoglossal nerve. Okay. So that is the first thing that you should be able to read very carefully. What is written? The hyoglossus is a muscle. Hypoglossal is a nerve. Right? See, Shamdeep is also making the same mistake. The lateral deviation of the tongue is due to the paralysis. All of these things that are written, they are muscles. They are not, there is no nerve here. Hypoglossal nerve, if it would have been in the option, that would have been an answer. Right? Hyoglossus is a muscle of the tongue. The ipsilateral deviation of the tongue that will occur will not be due to the damage to hyoglossus. It will be due to the damage to another muscle. Alright, and we have talked a lot about that muscle. It is also known as the safety muscle of the tongue. And that muscle is the genioglossus, not the hyoglossus. It is the genioglossus. The answer is going to be A, genioglossus. Okay, 133, the answer is A. Now, question number 134. Okay, I hope now you all understand question number 133. What was the mistake that you all were making? You all were thinking about the hypoglossal nerve, whereas what was written was a muscle that was known as the hyoglossus. Okay, so be very careful when you attempt such questions. Try to make a mistake in a such a simple thing, you know? So you guys have started answering the 134th question. Okay. Now, since we have already discussed this question, I want you to answer what is the second content of the Dorello's canal. Okay. I know that a lot of you already know the answer to 134. So I will make 134 a little difficult and I want you to tell me what are the two contents of Dorello's canal. What are the two contents of Dorello's canal? It is a dural fold. Yes, right. So the answer is B, abyssal nerve. And Mishti has correctly pointed out that the second content is the inferior petrosal sinus. The second content is the inferior petrosal sinus. There are two contents of the Dorello's canal. One is the abyssal nerve, that is the sixth nerve, and the second content is the inferior petrosal. Absolutely correct. Okay, question number 134. The answer is going to be abyssal. Question number 135. The first branch of the facial nerve is. What is the first branch of the facial nerve? Okay, so Shabnam is saying B and Mishti is saying D. Shabnam is confused between, I think she'll be confused between B and D. Nothing to be confused about it. It's a very clear cut answer. Niharika is saying she thinks D, greater petrosal nerve. First, tell me the lesser petrosal nerve. Where does it come from? Where does the lesser petrosal nerve come? First branch has been asked, not the first motor nerve. First branch. So the lesser petrosal nerve, where does it come from? Then let's talk about the greater petrosal nerve and the nerve stapedius. So when you talk about the facial nerve, it comes here from the facial nucleus, moves in the nervus intermedius, then it has also has a motor root. Both of these pass in the internal auditory meatus, they come here, and then they have the genu and everything. Here you have the geniculate ganglion. Here you have the geniculate ganglion. Remember, you have a geniculate ganglion. And the greater petrosal nerve, it passes through here, it does not relay, and it exits out from here, right? After that, it moves in the facial canal along the middle ear, comes down, and then it moves in the posterior wall of the middle ear and gives the nerve to the stapedius. Okay. But before it has given the nerve to the stapedius, it has already given its first branch, that is the greater petrosal nerve, which will combine the deep petrosal nerve and form the nerve of the pterygoid canal. Okay. So the first branch that comes is the greater petrosal nerve, that is the first branch from the facial nerve, right? What is the first motor branch? That is right. That is the nerve to the stapedius. The first motor branch of the facial nerve is the nerve to stapedius. And the lesser petrosal nerve, as you all have correctly pointed out, it comes from the tympanic plexus, which is formed by the glossopharyngeal nerve plus sympathetic fibers around the carotid plexus, and that is the origin of the lesser petrosal nerve, which again will carry parasympathetic fibers. Okay, so that is about the lesser petrosal nerve. So 135 question, absolutely crystal clear. Answer will be 136. Structures passing through the foramen rotundum. First embryonic branch of facial nerve. Okay. First embryonic branch of facial nerve. I'm not aware of this. I'll have to check it up if you have any idea of this. I've never heard about the first embryonic branch of facial nerve. Yes. The structures passing through the foramen rotundum. The answer is going to be D, the maxillary nerve. So you know superior orbital. Here you will have ophthalmic passing. From foramen rotundum you will have maxillary nerve passing. From foramen ovale you will have the mandibular division of trigeminal. The answer is going to be maxillary. Question 137 is about the structures passing through foramen ovale. As I have already told you, the foramen ovale gives passage to mandibular nerve, and the mnemonic is for structures passing through foramen ovale is ovale, where O is not a structure passing, it refers to otic ganglion. It is closely related to the mandibular division of trigeminal, which passes through the foramen ovale. A is accessory meningeal artery. And you have to know what is L and what is E. Very easy. E is always a mystery vein. Question number 138. What are the structures that pass through the jugular foramen? L is very easy, guys. We have already discussed it. Lesser petrosal nerve, as far as I can remember. Remember, guys, there is a greater petrosal nerve, there is a lesser petrosal nerve, but there is no deeper petrosal nerve. It's called the deep petrosal nerve, right? Similarly, there is a greater occipital nerve, there is a lesser occipital nerve, but there is nothing like the greater auricular nerve. It is only the great auricular. Alright, those are two concepts you should be aware of. The answer here for the structures passing through the jugular foramen, you will the options are very easy, so the answer is obviously very easy. The answer is going to be the glossopharyngeal nerve. Okay, question number 139. It is a PGI type question, so obviously I will tell you that it is a multi answer correct. It is a multiple answer correct. Okay, you all are saying the answer is going to be multi answer correct. Question 139. Please choose your answers. Absolutely correct. A, B. No, 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 absolutely not correct. It's A, B, C, E. Alright. The answer will be A, B, C, E. Now tell me what is wrong with statement number D first. Okay. So see, pituitary gland, it is separated from the optic chiasma by the sella turcica. That's true. Okay. And it is situated deep in the sella. Right. That's true. That is where you will have its location. And since it, so the sphenoidal layer cells, they are present inferior to it. And there is a significance of that. That is why you are able to perform a transsphenoidal hypophysectomy. Okay, you can approach the pituitary for a surgical operation via the sphenoidal air sinus. Okay, by inserting a probe inside. Then it develops from the base of the third ventricle from the pars anterior. What is wrong in this statement? You tell me. Alright, what is wrong? It is supplied by a branch of the internal carotid artery. That is true. There are superior hypophyseal and inferior hypophyseal arteries which are formed, which are the, this is the meningiohypophyseal branch. They come from the meningiohypophyseal branch inside the cavernous sinus. So the branches of the internal carotid artery arise from its cavernous part. Will give the superior and the inferior hypophyseal artery. So its blood supply comes from the internal carotid artery. Yes. Okay. So option D, why is it wrong? It's wrong because instead of pars anterior, it should have been pars posterior. It should have been pars. Okay. Okay, Bindu, I'll try to make it a little fast. So see, my speed is decided by the speed at which you guys answer. Uh, Otherwise, the option I have is to skip explaining any questions at all, which won't make a lot of sense because every time somebody is definitely giving some wrong answer. So let's start with question number 140 and I can see how I speed it up. Right? The recurrent laryngeal nerve, it supplies which of these muscles? The recurrent laryngeal nerve supplies. No, Shabnam, absolutely wrong. You've picked the one answer that is definitely wrong. Mhm. The cricothyroid muscle, it is the only muscle of the larynx that is supplied by the external laryngeal nerve. So cricothyroid muscle, you should definitely remember as an exception that it is the only muscle of the larynx that is supplied by the external laryngeal nerve. So cricothyroid will definitely not be in your answer. Alright. So the recurrent laryngeal nerve, it supplies all the muscles of the larynx except the ecothyroid muscle, except the ecothyroid muscle. So C is definitely wrong. T is not a muscle of the larynx, it is a muscle of the pharynx, so it will be supplied by the vagoaccessory complex. E is also not a muscle of the larynx, it is a strap muscle. Omo, however, it is supplied by the ansa cervicalis. So what is remaining? A and B, and these two muscles are muscles of the larynx that will be supplied by the recurrent laryngeal nerve. So the answer is going to be A and B. 140th, the answer is going to be A and B. Question number 141. Which of the following are draining channels of the cavernous sinus? Which of the following are draining channels of the cavernous sinus? Draining channel means they will take away the venous blood from the cavernous sinus. What are tributaries? Tributaries are the ones that will drain into the cavernous sinus. Alright. So if this is the cavernous sinus, venous blood coming inside, venous blood here, venous blood going here. These are the tributaries. This is the cavernous sinus. Smile with Bindu, your answer is coming right now, 446, when I've already discussed the question. So now, I've already told you that E will not be there because homohyoid is supplied by answer cervicalis. So because of that, I have to explain every question and it takes a little time. Alright? Because my speed is decided by the speed of your answers. and these are the training channels. These are the training. After today's class, these three MCQ classes that we have done, you will not have to practice any additional MCQs for head and neck, and that is your complete revision of a head and neck, because we will be done with around 180 questions, 180 MCQs of head and neck, which is sufficient for head and neck and neuroanatomy. 141, the answer is, there's only just one answer, alright, first of all, no multiple answers. There's only one answer, alright. The one answer is inferior petrosal option, right? Superior ophthalmic vein, no. Sphenoparietal sinus is a tributary, not a draining channel. Superior ophthalmic vein is both a draining channel and a tributary, but we'll consider it better to be a tributary rather than a draining channel, because superior ophthalmic vein is actually a valvulus emissary vein. So blood can flow in both directions, but we'll consider it to be a tributary, right? And not the middle cerebral vein as well. Question 142, which is the first branch of the external carotid artery. So I have emphasized this a lot, that which is no Niharika, it's only A. Only A. Right, so the first branch is the superior thyroid artery. I hope you can still recall all the 8 branches of the external carotid artery. And this was the way to recall them. There was a way to record them: the anterior, medial, lateral, and terminal branches. And this was the way I had told you that you have to recall these. Medial, remember, there's only one branch. Lateral, you have to know that the mastoid process separates 2 branches. Anteriorly, you have 3, and terminal branches are 2. The first branch is the anterior branch, that is one of the anterior branches, that is the superior thyroid artery. Okay. Anterior ethmoidal is a branch of the ophthalmic. It is not a branch of the external carotid. Okay. Occipital and posterior auricular are the posterior branches. Question 143. Which of the following transmits a nerve branch to the meninges? Which of the following transmits a nerve branch to the meninges? Right. So the answer is going to be 143. What is the answer going to be? Please write 143 in front of your question, so I know that you're answering for 143, not for 142. So sometimes both consecutive questions are the same answers, and I tend to get confused. Foramen magnum. No. Yes, Gohar has given the right answer. The answer is foramen spinosum. It transmits a nerve, that is the nervous spinosum, which is a recurrent branch coming from the, this is the mandibular division of the trigeminal. This branch goes upwards, and this is the nervous spinosum, which is a branch for the meninges, Alright. Question number 144. It is an easy question. You have to tell about the correct sequence for the flow of CSF. correct sequence for the flow of gases? Very easy, just answer it quickly so that we can move ahead. Kahar has already given the correct answer for 143. Okay, so for 144, you've answered A again, Mishti, Kahar, and Niharika. Right, so you're right. So it starts from the lateral ventricle, goes through the third ventricle, then aqueductus sylvis. Easy question. I'll move on to question number 145. Which of these is not a tributary? Not a tributary of the cavernous sinus. Which of these is not a tributary of the cavernous sinus? Question 145. Remember the concept of tributary and draining channel. Remember the concept of tributary and draining channel. Shabnam Khan has said A, that is sphenoparietal sinus. I just told you that the sphenoparietal sinus is a tributary. Is a tributary of the cavernous sinus. It is coming from the lateral side. Sphenoparietal sinus is a tributary of the cavernous sinus. Answer to 145 is not A, as I just explained. The answer is going to be B, yes, superior petrosal sinus. Why? Because the superior and the inferior petrosal sinus, they are draining channels. They are draining channels rather than being tributaries. Alright? So the answer is going to be option B. They are draining channels. Question number 146. Tensor tympani is supplied by. Question number 146. Tensor tympani is supplied by. So we are coming very close to the end of our 150 question MCQ marathon. Right, most probably this will finish by 5 p.m. After that, today itself, I will continue this lecture and I have some 20 to 25 additional MCQs to cover concepts that I have not been able to cover previously in the last 6 or 7 classes that I have taken. Okay, so these are bonus MCQs. You can attend the discussion for these MCQs if you want. We'll definitely be doing these in a quick way. So answer to 146 is B, the mandibular branch of the fifth nerve. So remember both the tensors, they are supplied, their branch comes from the trunk of the mandibular division of the trigeminal. So both the tensors, the tensor tympani and the tensor palatini. Both of these are supplied by the mandibular division of the trigeminal. Question number 147. All of the following are grouped together as muscles of mastication except. ओके शबनम ने ए 144 के लिए किया था. ओके इसके लिए सबने भी कर दिया है मैंडिबुलर ब्रांच ऑफ फिफ्थ नर्व. ऑलराइट गॉट इट. स्माइल विद बिंदु 3 बार आंसर लिख दिया. 147 का बताओ। हाँ 146 का बी है, डन, वेरी गुड। 147 लिख देना अपने क्वेश्चन के आगे। अब मसल्स ऑफ मास्टिकेशन कौन सी है, कौन सी नहीं है, राइट? So absolutely correct. Buccinator is not a muscle of mastication. Buccinator is a muscle of facial expression. Is a muscle of facial expression, but it plays a role, accessory role in mastication by keeping the food here. All right, but it is supplied by the facial nerve. It is not supplied by the trigeminal nerve. The masseter, the temporalis, and the medial and the lateral pterygoids. All these four are going to be muscles of mastication supplied by mandibular division. Okay. Question number 148. A patient presented with normal eyesight and absence of direct and consensual light reflex. Which of the following cranial nerves is suspected to be lesioned? Alright, so you are being told that the eyesight is normal, but there is an absence of the light reflexes. Right? So you have to choose which nerve will be damaged most probably. You're saying the correct answer is C, 148. So, see, I'll tell you how you have to. Okay, I don't know why you all are choosing the absolute wrong answer, Gauhar and Mishti. See, it is written that the patient presents with normal eyesight. Since the eyesight is normal, this is an indication to you that the afferent pathway of the light reflex, that is through the optic nerve, is not damaged. The optic nerve is fine. Otherwise, the patient will not have normal eyesight. Patient will also have eyesight abnormalities. Alright? The optic nerve is fine, but the absence of the direct and the consensual light reflexes show the efferent pathway is damaged, that is through the oculomotor nerve. So that has to be damaged. So the answer is going to be oculomotor. 148, the answer is going to be option A. 149. Okay. So eyesight is normal, so please don't select the answer as optic nerve. Okay, Gahar and Mishti. Now let's move to 149. The following are supplied by the 12th cranial nerve except. The following are supplied by the 12th cranial nerve except. Okay, again, 12th cranial nerve, it will supply all the muscles of the tongue except one, all muscles of the tongue except one. And what is that one muscle it does not supply? It is also a muscle of the palate, so it is supplied by the vagoaccessory complex. So answer for 149 is option A, the palatoglossus. The genioglossus and the hyoglossus both are supplied by the 12th cranial nerve. Question number 150. Which of the following is not supplied by the ansa cervicalis? Which of the following is not supplied by the ansa cervicalis? Question number 150. Last question of this question bank, the single question bank that we have done for MCQ Marathon 1, 2, 3. So 150th, Mishti has given the answer. Are there any other answers that are conflicting with this? Right. Purpose, it was also given B, so I will tell you the answer is B. Hyrohyoid and geniohyoid. These are two muscles that are supplied by C1, which piggybacks, the word used is piggybacks on the hypoglossal nerve, right? The rest, the sternothyroid, the sternohyoid, and the omohyoid, the strap muscles, these are supplied by the ansa cervicalis through its superior and inferior roots, and the stern, that is the known as the ansa cervicalis, right? Power is also given the correct answer. So let me tell you guys that you have successfully solved in the last 3 sessions. So what all have we covered so far? We have covered the cranial nerves in 2 lessons, covered the blood supply of the head and neck and the brain and everything. We've covered the chapter of the scalp, temple and face. I have covered the orbit with you. I have covered the nasal cavity. I have covered the pharynx. And we've also done 150 MCQs from a single question bank so that you have complete coverage here. Plus now we are going to be doing bonus MCQ. Okay. This is a list of everything that we have done so far, right? And we've also done the columns here, right? The columns here. And I want you all, yeah, finally 150. Congratulations everyone. And I can see a lot of you were giving a lot of right answers. So that's great. Kudos to you. I want you all to definitely watch the lecture on the cranial nerves and the blood supply. Okay, so these, from my side, these lectures are must watch. You can also watch this, just 15 minutes an introduction to the pharynx was also fine, and you've solved all these MCQs. If you want to stay for the discussion of the bonus MCQs, you can. Otherwise, you will be free to leave. So let's start with these MCQs. I'm glad, Niharika, you liked the revision. Thank you, Bindu. Thank you, Gohar. Thank you, Mishti. If you guys really liked the session, do 2 things. First, do subscribe to my Telegram channel, that is at the rate NEET PG, and my name, that is Chetanya. And if you take a plus subscription, do use my referral code Chetanya10. If you know anybody who's taking a plus subscription or a prep ladder plus subscription using Iconic, use the referral code Chetanya10. Please tell me, I will help you with that. And the third thing is that interacting, I guess, right? And you can drop a comment after the session has stopped streaming, or you can drop a comment in one of the previous lessons to make sure that it goes on the record, or hit the like button. That should, right. So let's keep on going with the bonus MCQs. First question is the upper border. I'll label this question as question number 151. Upper border of the thyroid cartilage is at what level? Upper border of thyroid cartilage. So let's just go over 152, question 153, question 154. Bindu is a final year student. Nice, good to know. A very good knowledge in first year subjects. Thank you so much. It's also I have this unfair advantage that I have just gone through all these subjects very recently. So I hope I'm still able to retain them this way till the final year. And yeah, great. All the best, I guess. So anybody taking an answer for question 151, the upper border of the thyroid cartilage is located at. So remember the upper border of the thyroid cartilage, it is the site of bifurcation. It is the site of bifurcation of the common carotid. common carotid artery divides into the internal carotid artery and the external carotid artery. This is the site of bifurcation, right? And as you remember, the site of bifurcation, anybody want to take an answer at what level this will be? The site of bifurcation will be at the level of C3, C4, right? Upper border of C4, lower border of C3. So upper border of thyroid cartilage is at the level of C4. That is the most appropriate option. Question number 51B. Yes, Mishti has given the correct answer. Answer for 151 is option B, right? Question number 152. Cricoid cartilage lies at which vertebral level? So I asked you about the thyroid cartilage in the previous one. Now we are going to talk about the cricoid cartilage. So upper border of thyroid cartilage lies at the 4 level, lies at the C4 level. Right, so it is the cricoid cartilage, and this C6 level is very important for one or two reasons. One reason is that here your pharynx becomes your esophagus and your larynx becomes your, okay. So C6 level is often asked. So just remember that, and it is also the level at which the cricoid cartilage is present. Okay. Question 153. Parafollicular C cells are derived from. So from which uh, particular embryonic structure do you have the parafollicular C cells coming out? Parafollicular C cells are the C cells present in the thyroid. Now, why are they called C cells? C refers here to clear cells. All right, members. Also, it is also true that they secrete calcitonin, but that's not why they are called. It's not the ultimo branchial body. No, that's wrong. There's a there's a one very specific answer here. All right, so ultimo branchial body can, okay. Now I agree sort of that, okay, ultimo branchial body is giving rise, yeah. So the answer that I was looking for very specifically was the neural crest cells, okay, because I feel that is the most appropriate option here. Um, but if the neural crest cell was not in the option, you could have gone with ultimo branchial. Yeah. See, the ultimo branchial body, first thing that you should know is that the ultimo branchial body is derived from the fourth pharyngeal pouch. All right, it is derived from the recess. It is derived from a recess of the fourth pharyngeal pouch. Technically, it is derived from the fifth pharyngeal pouch, but from in the humans, the fifth pharyngeal pouch is considered to be rudimentary, and it actually merges with the fourth. Right. So if you have to be very technical, the ultimobranchial body is derived from the fifth pharyngeal pouch. But since in the humans it is rudimentary, it is said to be merged with the fourth pharyngeal pouch, and it develops from the ventral recess of the fourth pharyngeal pouch. And specifically the parafollicular C cells, they come from the ultimobranchial body, but even more specifically, if you go, they are a derivative of neural crest cells. Okay, derivatives of neural crest cells, as you know all, it's a very important question anyway. Question number 154, deep injury of the neck always involves. What is the definition of a deep injury of the neck? Deep injury of the neck. Okay. Since I have not got any answer, the answer is going to be platysma. The answer is going to be platysma, because platysma is a muscle here, superficial muscle that is present subcutaneously, right? Whenever you have a deep injury of the neck, it will always involve, you will always have to have penetration of platysma, right? So, see, trapezius, sternocleidomastoid, longus calli, all of these are very localized muscles, but whenever you have a deep injury of the neck, you will always have to have the platysma pierced, right? So, that is question 154. Question number 155, falls about the scalenus anterior. Falls about the scalenus. Yes, absolutely true. The answer is D, Niharika. Involvement, it does not form the floor of the posterior triangle. See, this is your scalenus anterior muscle, let's say. You have to remember it is covered superficially by the prevertebral, covered here by the prevertebral fascia. I'll show you a diagram. It's there in the last question. This is covered by the prevertebral fascia. Okay. Then anteriorly, we will have the phrenic nerve running. Okay, it is covered by the prevertebral fascia again, but it is present anterior to the scalenus and the phrenic nerve. Okay, so this is true, this is true. Then it inserts in the inner part of the first rib. This is absolutely true. So these three are true at the scalene tubercle, alright? But it does not form the floor of the posterior triangle. Scalenus medius will form the floor of the triangle. Scalenus anterior का कुछ part कभी कभी आ जाता है, but not generally. So question 156. Another important question from our cranial nerves class. Which of the we have discussed this that time also. Which of the following is not supplied by the anterior division of the mandibular nerve? So the following is not supplied by the anterior division of the mandibular nerve. Medial pterygoid, right? Bindu is right. Medial pterygoid. So what happens? This is the main trunk of the mandibular nerve. It divides into an anterior division. It divides into a longer division, that is the posterior division. Three branches here: auriculotemporal nerve, here alveolar nerve. You tell me what is the one that I have not written here. I'll बता ही देता हूँ. Here you will have branches to the temporalis. ये थोड़ा हिंदी में भी एक्सप्लेन कर देंगे. ओके, देखो ये मैंडिबुलर एंटीरियर डिवीजन, तुम्हारा मैंडिबुलर नर्व आ गई. मैंडिबुलर नर्व दो में डिवाइड करती है, एंटीरियर डिवीजन और पोस्टीरियर डिवीजन. जो एंटीरियर डिवीजन है उसकी ब्रांचेस होती है, टेम्पोरालिस को जाती है, मैसेटर को चली जाती है और लैटरल टेरिगोइड को चली जाती है. एक सेंसरी ब्रांच देती है, वो जो होती है बक्कल ब्रांच. ठीक है. पोस्टीरियर डिवीजन जो ज्यादा बड़ी डिवीजन है वो देती है ऑरिकुलर टेम्पोरल नर्व, लिंगुअल नर्व और इंफीरियर एल्वेओलर. ठीक है. और मेन ट्रंक जो है उससे एक ब्रांच आएगी जिसका नाम होता है मीडियल टेरिगोइड नर्व. ठीक है. तो the question is asking ki which nerve is not supplied by the anterior division of mandibular. So the answer is going to be medial pterygoid, because medial pterygoid की जो branch है that is coming directly from the trunk. ये branch directly trunk से आ जाती है. ठीक है. इसलिए anterior division नहीं supply. क्वेश्चन नंबर 157, बताना है क्या फॉल्स है स्टर्नोक्लीडोमास्टोइड के बारे में. विच इज द फॉल्स स्टेटमेंट अबाउट SCM, that is the sternocleidomastoid muscle, right, which is another muscle of your. Question number 157, guys. What is the answer that I should expect from you all? Right. So Mishti, Niharika and Bindu have all said the answer is D. So you are probably aware of the actions of the sternocleidomastoid. So first, it has a sternal head and it has a clavicular head. So this is true, right? Then it inserts on the mastoid process. This is also true. It is coming from here, coming from here, and like this, right? So the action is like this, and its motor supply is by the spinal axis 3 nerve. So it will tilt the head to the same side, and it will turn the head to the opposite side. If I'm using my right sternocleidomastoid, it will turn the head to the other side. But if I have tilt my head, it will tilt the head to the same side. So this is wrong. tilts head to the same side, turns head to the opposite side. Okay, so that's about the actions of the sternocleidomastoid. Question number 158. Which suprahyoid muscle? Which suprahyoid muscle is supplied by both the facial and the mandibular nerves? It's supplied both by the facial and the mandibular nerves. Okay, right. So all of you said the answer is digastric. Absolutely true. Like I've already told you, there is an anterior belly of the digastric, there is a posterior belly of the digastric, accompanied by the stylohyoid. Right? So they will enclose the digastric triangle. But anyway, this is supplied by the mandibular nerve and this is supplied by the facial nerve. These both are supplied by the. That's the answer. Question number 159. Question number 159. To about the Fox cerebri. So as you know, Fox cerebri, Fox means sickle-like. Fox means like, cerebri means it is present in the cerebrum. The sickle-like fold of dura mater present in the cerebrum, so that is known as Fox. One of these is true. Question number 159. Okay, so you all are saying C. It separates the two cerebellar hemispheres. पिछले का आंसर बता रहा है. He contains the straight sinus. All right, that looks pretty much correct to me. So does it separate the cerebellum from the occipital lobe? No, it does not. That is the tentorium cerebelli. That is true for the tentorium cerebelli, not for the Fox cerebelli. Now, which separates the two cerebellar hemispheres? That's the Fox cerebelli, right? Not the Fox cerebri, right? And that will also contain, you have the occipital sinus there. But here the straight sinus. Straight sinus is a fold present in the Fox cerebri, alright? Straight sinus, it is also known as the tentorial sinus, alright? It is also known as the tentorial sinus, and since it is straight, it is also known as sinus rectus, alright? So it is basically present where the Fox cerebri will merge with the tentorium, right? So it is present somewhere here, but it is you can select B to be the accurate answer. So question number 160, all are paired venous sinuses except. So which of these sinuses that are given are not paired, alright? So when you talk about your dural venous sinuses, you have divided it into the paired and the unpaired sinuses. Okay, so batao answer. So 160, all are paired venous sinuses except one. Which is that one that is not paired? The answer is C, superior sagittal. Absolutely correct. So let me, Mishti has answered correctly and Papa Situ has also answered correctly. So let me just give you an idea as to what are the paired and the unpaired sinuses of the, right? So let's talk about the classification. We've not covered dural venous sinuses as a separate topic, right? Classification of dural venous. Like I told you, there are paired sinuses and there are unpaired sinuses. Now, which are the unpaired ones? Obviously, one, like I told you, the superior sagittal sinus. Okay, correspondingly, the inferior sagittal sinus. Then you know the inferior sagittal sinus, it drains into the straight sinus or the sinus rectus or the tentorial sinus, right? Then you have posteriorly located the occipital sinus, which is another unpaired sinus. And then you have two sinuses which will connect the cavernous. One is the anterior intercavernous sinus. The other is the posterior intercavernous. And lastly, you have a basilar venous plexus. It's present uh, so it's also venous plexus. So that's why we've considered it a unpaired sinus. Now, next, if you talk about the paired sinuses, first is the right and the left transverse sinuses. Remember, the superior sagittal sinus will drain into the right transverse sinus generally, and the straight sinus will drain into the left transverse sinus generally. Second is your sigmoid sinus. Both sides you have it, and it goes into the jugular foramen if you remember, and forms the internal jugular artery. Then the cavernous sinus, you have two cavernous sinuses on each side, one on each side. Then it is drained by the superior petrosal sinus and the inferior petrosal sinus. So these two draining channels, they are also paired. Then there are some tributaries of the cavernous sinus. One is the sphenoparietal sinus, is again a paired sinus. Besides that, you have two sinuses. One is these are kind of not very significant, but I'll still discuss them. One is the petrosquamous, and the last is the middle meningeal sinus. Okay, so these are all the sinuses that are paired, unpaired in the. You can see the answer here for the unpaired sinus will be superior sagittal. I hope you have taken a screenshot here. If you haven't, I'll just erase this. Okay, so that's about this whole classification. You can take a screenshot and let's move ahead. Question number 161. Which of the following are draining channels? Which of the following are draining channels of the cavernous sinus? Absolutely correct. Inferior petrosal sinus is the draining channel. So we've already discussed this. Let's move on. Question 162. The two internal cerebral veins, they unite to form. What do the internal cerebral veins unite to form? Right, 161 is A. That is why I have moved ahead. The two internal cerebral veins, they unite to form. I think purpose it was answered this question. It is the great cerebral vein of Galen. Great cerebral vein of Galen. So that is where the two internal cerebral veins will unite. They will form the great cerebral vein of Galen, which will go and merge with the inferior sagittal sinus to form what? Straight sinus. Yes. Question 163. Alright, question 163. All are features of the cavernous sinus thrombosis. All are features of cavernous sinus thrombosis, etc. So what is cavernous sinus thrombosis? Whenever there is any thrombi and it enters the cavernous sinus. An easy question. Don't worry about the options that you know nothing about. Only think about the options that you know something about. Okay? Right, absolutely correct. Mishti thought a lot about this and she's reached at the right answer. That is the sensory deficit on the face due to involvement of the three branches of the trigeminal nerve. Remember the three branches of the trigeminal nerve, they are the ophthalmic, the maxillary, and the mandibular. And remember the ophthalmic and the maxillary, even though they are located in the lateral wall of the cavernous sinus, the mandibular is not at all related to the cavernous sinus, right? So the answer will, there will be sensory deficit, but that will be only due to the ophthalmic and the maxillary loss, not due to the loss of the mandibular division of trigeminal. This C is the correct answer. Proptosis means, so this proptosis word, it basically refers to an abnormal displacement of the eye. For example, like you have exophthalmos, which can occur due to the pulsations of the internal carotid artery as well. You might have heard of pulsating exophthalmos. So yeah, there can be exophthalmos. Why can there be papilloedema? Because the venous drainage, when it gets blocked, it will apply pressure there on the optic disc, right? Because the veins, they are coming out from the optic nerve itself. So there can be papilloedema, there can be proptosis, and due to the compression of the motor nerves to the eyeball muscles, there can also be external ophthalmoplegia, right? Since you can see the third, the fourth, and the sixth, All of these are in some way related to the cavernous sinus. The sixth passes from inside, and the third and the fourth are present in the walls of the cavernous sinus. Question number 164. Septic emboli in the facial vein, they can cause cavernous sinus thrombosis because the facial vein makes clinically important connections with the cavernous sinus, which is the most commonly involved communicating vein. Proptosis is any abnormal displacement of the eyeball, right? That is proptosis. So we have around a few questions left. Right. So since I have not got any answers, I'll tell you that there are two communication channels. One is the superior ophthalmic vein. The other is the pterygoid plexus of the veins via the deep facial vein, right? So answer is superior ophthalmic vein because it is the one that is most commonly involved. So if this is your eye, you have the superior ophthalmic vein going behind from here, right? Get a connection here from the angular vein, right? That is your cavernous sinus. Since it is a very direct connection, that is why it is the one that is most commonly involved. The cavernous sinus, this is the superior ophthalmic vein, right? It is not deep, it is not, the answer is not deep facial, the answer is superior ophthalmic vein. I'll tell you why. Then you have an emissary vein here, which connects this to a plexus here known as the pterygoid plexus. This pterygoid plexus is connected here to the facial vein. So this is the angular vein, that is another branch of the facial vein. Here it is connected to the facial vein via the facial vein. This is known as the pterygoid plexus. Since this is an indirect channel of the danger area of the face, the most commonly one that is involved is the superior ophthalmic vein. It is also an emissary vein. It is valveless and it forms a communication here between the cavernous sinus and the angular vein. Yeah, so there are two connections. One is the superior ophthalmic. So, and also think if you have to answer deep facial, you have to answer pterygoid plexus because they're essentially the same channels, right? That's about this question. This was question number 164. Question number 165. The submental lymph node of drainage. Submental lymph node of drainage. The drainage of the submental lymph node. I'll लिखा हुआ है question. Which of the it basically means that what are all the parts that drain into the submental lymph nodes, and since it says except, you have to tell which part does not drain into the submental lymph node. Question number 165 is asking you which part does not drain into the submental lymph nodes. You should remember a very important question here is asked that the tip of the tongue, where does it drain? So you have to remember the tip of the tongue, it will drain here into the submental. Very easy to answer if you just think about the location. Okay. Yeah, so the tip of the tongue, the floor of the mouth, and the lower lip. All these three are drained by the submental lymph nodes. Whereas the yeah, right. So 165, the answer is going to be A, anterior palate. So you can see that the tip of the tongue, the floor of the mouth, and the lower lip. All of these are related here to the submental lymph nodes. They will all drain into the submental lymph node. Whereas the anterior palate is present superiorly. So it will not be draining into the submental lymph nodes. Rather, it will prefer to drain to the submandibular lymph node. Question 166. Lymphatic drainage of the anterior part of the nose. Anterior part of the nose is to which lymph node? Right? Question 66. Lymphatic drainage to anterior part of nose. Remember, whenever you study the lymphatic drainage of the nose, it is studied in two parts, anterior and the posterior. The answer is relatively simple, but it is important to know the differentiation between the anterior and the posterior lymphatic drainage of the nose. Okay, we did not cover this in the lecture on the nose, so that is why I have brought this question. Right, so the anterior part, it drains into the submandibular lymph nodes. If you don't know the answer, please do write I don't know, so that I can know that I have to explain it, because otherwise I will keep waiting for your answers and the class will head over. The anterior goes into the submandibular lymph nodes, the posterior goes into the retropharyngeal lymph nodes, and via the retropharyngeal lymph nodes it goes into the deep cervical nodes. Okay, so the answer here is not going to be retropharyngeal, it is going to be submandibular lymph nodes. Question 167. Which of the following is not true about deep cervical lymph nodes? Easy question, question number 167. Which of the following is not true about the deep cervical lymph nodes? One important part that we have not covered, that I should have covered, is the triangles of the neck. Yeah, so it is given fine enough in your BTC. You can read triangles of the neck once. Yeah, उसकी understanding थोड़ी important है, contents, boundaries. So if you can tell me, please, if you don't know the answer, please like write I don't know. Otherwise, please take a guess for question number 167 as to what will be the answer for question 167, which is asking which is not true about the deep cervical lymph nodes. कौन सा true नहीं है? पहला ऑप्शन है कि वो एक्सटर्नल जुगुलर वेन के लॉन्ग लाई करते हैं, और दूसरा ऑप्शन टॉन्सिल ड्रेन होता है जुगुलो डाइगैस्ट्रिक नोड से, तीसरा ऑप्शन दे लाई डीप टू द स्टर्नोक्लीडोमास्टोइड, चौथा ऑप्शन द टंग ड्रेन्स इनटू द जुगुलो मोहायोइड. So the correct answer is option A, because these nodes, they lie along the internal jugular vein rather than lying along the external jugular vein, right? So that is the first thing about these nodes, that they lie along the internal jugular vein. Tonsil is definitely drained by the jugulo-digastric nodes. They lie deep to the sternocleidomastoid, and the tongue it will drain into the jugulo-hyoid nodes. This is a very important fact, right? So Mishti is saying C. No, it's not C, because the deep cervical lymph nodes, they do lie deep to the sternocleidomastoid, where you have the internal jugular vein passing around it. You have mainly the two main lymph nodes here are the jugulo-digastric and the jugulo-omohyoid. Okay, so there are these two options, option B and D are two options that I want you to remember. A is about, I want you to remember is about tonsil. Second, I want you to remember tongue. Tonsil goes into jugulo-digastric and tongue goes into jugulo-omohyoid. ठीक है, बस ये दो चीजें जरूर याद रखना रिगार्डिंग द लिम्फ ड्रेनेज. Okay. Question number 168. Fascia around the nerve bundle of the brachial plexus is derived from. Fascia around the nerve bundle of the brachial plexus is derived from. ठीक है, तो ये देखो, ये एक्सिलरी शीथ की तरह कंटिन्यू करता है एक fascia. This is from the question of the deep fascia of the neck. This is from the topic, the deep fascia of the neck. Yes, vertebral fascia, that's correct. Mishti has given the correct answer. The fascia around nerve bundle of the brachial plexus. This is the axillary sheath, right? So the prevertebral fascia present here. So the brachial plexus, it is arising between the scalenus anterior and the scalenus medius. So here this continues as the prevertebral fascia continues as the axillary sheath outward, and it is a extension of the prevertebral fascia, the axillary sheath which surrounds the brachial plexus, right? Question number 169. On both sides, the submental triangle it is bounded by. This is your submental triangle. This is your orientation. पहले बताओ 169 का आंसर, फिर मैं एक बार समझाता हूँ थोड़ा सा ये. एंटीरियर ट्राइंगल क्या, पोस्टीरियर ट्राइंगल? So you're saying the answer is B. Okay, so very simple. The This is the submental triangle. Okay, so this is the posterior belly of digastric on one side. This is the anterior belly of digastric on one side. The anterior belly of digastric on the other side. And the posterior. This triangle is the This whole triangle is the submental triangle. This is half submental triangle. This is half submental triangle. And you can see on both sides, it is bound by the anterior belly of digastric. Okay, so that is this orientation. And okay, एक चीज याद रखना that the sternocleidomastoid divides the head and neck into the posterior and the anterior triangles. In the anterior, you have four triangles, in fact, three and a half. Half submental on each side. You have half triangles, half submental triangle. Then you have a muscular triangle. Then you have a carotid triangle, and then you have a digastric triangle. Basically, have all these triangles. This is the digastric triangle between the anterior and the posterior bellies of. Question number 170. All the following are contents of the suboccipital triangle. So we have not discussed the suboccipital triangle. So what is important is its contents. Its boundaries are mainly formed by muscles of the back, which are not very important for UG level. So contents of the suboccipital triangle, you have to know about the. There are three contents of the suboccipital, right? Right. So answer is occipital artery, as Mr. is correctly pointed out. So these three are contents of the suboccipital triangle. The third part of the vertebral artery. Remember which part of the vertebral artery? The third part of the vertebral artery, the dorsal ramus of C1 and the suboccipital plexus of veins. Occipital artery, it is a content of the occipital triangle, not of the suboccipital triangle. Alright. Question 171. All of the following are in the anterior triangle of the neck except. You know there is a digastric triangle, there is a muscular triangle, there is a submental triangle, and there is a carotid triangle. But subclavian will not be a content here of the anterior triangle of the neck. These are the four parts of the anterior triangle of the. Yes. So the posterior triangle is divided into by the inferior belly of the omohyoid into two triangles. One is the clavicular triangle. Okay. The other is the occipital triangle. So it is a content of the occipital triangle. The occipital artery is a content of the occipital triangle. Absolutely correct. Question number 171. So that this I have directly kind of answered it for you. I hope this is clear because we've already discussed which are the four triangles, and that is the logic behind this answer. Let's move to question 172. I want you to answer question 172. Right. So 172, the answer you're saying is C, shrugging of shoulder. Absolutely correct. So why I've gone with shrugging of shoulder rather than overhead abduction of arm? Mishti, so I hope you can explain that why you have chosen shrugging of shoulder. Overhead abduction of arm, it is done by two muscles, that is trapezius and the other muscle is serratus anterior, right? So although both will definitely be affected, the overhead abduction of the arm is also affected, but shrugging of the shoulder is one of the main actions of the trapezius. So shrugging of the shoulder will be problematic. Overhead abduction of arm is also aided by the serratus anterior. So we have gone with option C. Okay, and what you have to understand is that if there is a cut in the in the middle part of the posterior triangle, so this is the sternocleidomastoid, this is the trapezius, and the artery was the nerve, that is the nerve for the spinal root of accessory. It is running like this. So there is a cut here, The sternocleidomastoid is spared. Why? Because the sternocleidomastoid has already been supplied. The spinal root of axis 3 was coming from here, right? From the spinal cord here. Okay. But the trapezius gets affected, and since the trapezius gets affected, there is problem in the shrugging of the shoulder. Okay. This is the last question for today, where I want you to identify the vagus nerve. Okay. The question says, this is question number 173. Identify the vagus nerve in the transverse section of the neck. Last question, guys. Question number 173. Identify the vagus nerve. This is a very important cross section for you all. This is the deep cervical fascia, transverse section. Ups, it is saying the answer is C. So yes, absolutely true. The answer is C. How do you identify the vagus nerve? It is present inside the carotid sheath, posterior lateral to the internal carotid artery, and medial to the internal jugular vein, right? This is C, that is your vagus nerve. Now, what is this nerve that is shown here in front of the scalenus anterior? Okay, so that is what you have to identify. First of all, this nerve that is present between the esophagus and the trachea. So this posteriorly, this is the esophagus, and anteriorly, as you can see, this is the trachea. Yeah, along with that, you can appreciate the thyroid. So this is the recurrent laryngeal nerve. This is the recurrent laryngeal nerve running upward. Right, it is a branch of the vagus. Then you have to know that in front of the scalenus anterior and behind the prevertebral fascia, what you can see is the phrenic nerve. What you can see is the phrenic nerve, and one more nerve that is seen here is the sympathetic trunk. One more nerve that is seen here is the sympathetic trunk. So you can see that this muscle here is the sternocleidomastoid. It is covered by the investing layer of deep cervical fascia, which moves backward, and it covers a few muscles here. Then this that covers the trachea and the esophagus together, this is known as the pretracheal fascia, and the fascia present posteriorly here, which covers all the muscles of the back, that is known as the prevertebral fascia, which extends to form the axillary sheath into the arm, which surrounds the tracheal fascia. Yes, you can also appreciate the answer cervicalis, which is a posterior relation of the carotid sheath. Very good, shabash. That is about this lecture, alright. And okay, एक और question रहेगा for two question रहेंगे, 3 4 5 बहुत क्वेश्चन है, मुझे लगा ये लास्ट क्वेश्चन है, सॉरी सॉरी. क्वेश्चन 174, माय बैड, ये मैंने शायद बाद में ऐड किए थे. क्वेश्चन 175, 176, 176, ये लास्ट क्वेश्चन, because I remember that the last question I put was an image based question. Let me just make sure that नहीं, 180 question है. Question number 174. Last 7 question, guys. The taste pathway from the circumvallate papillae of the tongue goes through. So now, why is this question important? Question is important because the circumvallate papilla, they are present in the anterior two-thirds of the tongue. They are present in the anterior two-thirds of the tongue. Okay, first thing. So you're saying 174D, absolutely correct, Mishti. It goes through the lingual branch of the glossopharyngeal nerve, even though the circumvallate papilla are present in the anterior two-thirds of the tongue, whose taste pathway supply goes through the corner tympani branch of the facial nerve. But the posterior one-third of the tongue and also the circumvallate papillae, they all go from the lingual branch of the glossopharyngeal nerve, right? That is an exception that you should remember for the circumvallate papilla. Question 1675. Protrusion of the tongue is not possible in the damage of. So, in what damage is the protrusion of the tongue not possible? Okay, question number 175. Again, an easy question. Okay, so 175, the answer is going to be D, that is genioglossus. That is going to be genioglossus because it is the safety muscle. It is the safety muscle, right? Protrusion of the tongue is not possible in the damage of genioglossus, right? So why is Mishti writing 180 ka D? It's 175 ka D, alright? The protrusion of tongue is not possible in the damage of the genioglossus. It is the safety muscle of the tongue. It is the only muscle of the tongue that is responsible for protrusion. Question 176. Parotid duct opens opposite to what? Or into what? Or opposite what? Right? So question 176. Question number 170. No worries, Mr. No worries. Opposite second molar. That's true. Parotid duct, it will open opposite to the second molar, upper second molar. Alright. That should be specified that it will open opposite to the upper second molar. Question 177. Otic ganglion. Otic ganglion supplies. So as you all know, we've discussed this multiple times. The otic ganglion will supply the parotid gland. So I will skip this question, move on to question number 178. A question that is very good and we haven't discussed. That is, which nerve loops around the submandibular duct? So submandibular duct, the nerve which has its course looping around it. Right, so there's a nerve that loops around the submandibular duct. Now, what is the name of that nerve that loops around the submandibular duct? Right, 177 is C. Absolutely true. 177, this otic ganglion innervates the parotid gland. That's fine. Lingual nerve, absolutely correct. कैसे पता? Lingual nerve होती है the submandibular duct के around. Super. Very good. Question number second last question. Question number 179. सारे muscles identify कर सकते हो तो well and good. So this is muscles of the larynx, right? So you have to been asked which muscle is responsible for abduction of the vocal cord. क्या abduction कौन करता है vocal cords की? इस diagram में से muscle identify करो. This is a visual image. This is a image based question. Yes. Okay. It's true, Mishti. That's posterior cricoarytenoid. You have to identify that muscle C was the posterior cricoarytenoid. You can see it is placed posteriorly. The anterior part. This is the posterior part. C is the posterior cricoarytenoid. You can see A is the lateral cricoarytenoid. B is the transverse cricoarytenoid. And D, as far as I can make out, it is the cricothyroid muscle. Right? And this is the vocalis. So abduction of the vocal cord, this is known as the safety muscle. This is known as the safety muscle of the larynx because it keeps the passage of the larynx open. The safety muscle of the larynx, option C, that is posterior cricoarytenoid, has been identified in the diagram. Last question, question number 180. Inferior thyroid vein drains into. We have discussed this yesterday also, that all the veins of the thyroid. चल पहले आंसर करो फिर बताता हूँ. Question number 180. ये पक्का लास्ट क्वेश्चन है. क्वेश्चन नंबर. Tomorrow we'll be doing neurophysiology. Tomorrow we'll be doing neurophysiology. यार वो इंटरनेट कनेक्शन फास्ट करने का वो नहीं है. It's related more to the fact that it takes time for people to answer those questions. तो क्लास में टाइम गैप्स आ रहे हैं. So you're saying the answer to 180 is C, brachiocephalic vein. Absolutely correct. So all veins of the thyroid, they drain into the internal jugular vein. All veins of thyroid drain into internal jugular vein, except the brachiocephalic vein, except the inferior thyroid vein, which drains into brachiocephalic. Drains into brachiocephalic. And it drains into brachiocephalic vein. The rest, there are basically three main veins: the anterior, the middle, and the inferior. And the inferior one is the one that drains into the brachiocephalic vein. That is all from my side for head and neck, guys. So far, I might take an additional class if I want to cover the triangles of the neck or maybe some other concept that I want to discuss with you. So that is it for head and neck anatomy and also the basics of neuroanatomy, which I covered through cranial nerves. All right. But there are a lot of other concepts in neuroanatomy as well. Let's see what all we can cover. So you guys can subscribe to the YouTube channel, that is Let's Crack NEET PG, and press the bell icon so that you keep getting notified every time I go live, and you can attend all the quizzes taken by other educators as well. And please, please, please don't use any other educator's referral code. Use my referral code Chetanya10, and I promise to give you the best deal that you get for any plus subscription that you take. Thank you for watching Unacademy's YouTube channel, Let's Crack NEET PG, India's largest online learning platform. Thank you so much. We'll be ending the stream now. If you have any doubts, you can ask me.